hyperparathyroidism. This is the primary hyperparathyroidism. It is a condition in which the level of the parathyroid hormone is high. But wherever we discuss or study about the primary problem, it means there is some problem into the gland. There is a problem into the main region. So, if we will discuss about the primary hyperparathyroidism, means that there is some pathology into the parathyroid gland. And most common cause of primary hyperparathyroidism is parathyroid adenoma. Parathyroid adenoma is the most common cause of primary hyperparathyroidism. Yes. You will say that this is a parathyroid gland, and if there is a tumor into the parathyroid, if there is a tumor of the parathyroid into the parathyroid gland, and we all know that if there is a tumor present, more than 80% of the tumors are the functioning in nature. This means that the secretion of the parathyroid hormone will be high. Number one, parathyroid adenoma. Parathyroid adenoma is called the secretion of the parathyroid hormone. So the secretion of the parathyroid hormone will be high. When the secretion of the parathyroid hormone will be high, what is the main function of the parathyroid hormone? To increase the serum calcium. To increase the serum calcium. So the level of the calcium will be high. And the level of the phosphate will be low. If ever asked you in exam that a 35-year-old or 40-year-old male present to you with a history of flank region pain in the flank region, peptic ulcer, polyuria, polydipsia, and upon investigation there is a high level of the parathyroid hormone, high level of the calcium, and low level of the phosphate, you guys will say it is a primary hyperparathyroidism. What are the lab findings in the primary hyperparathyroidism? High level of the parathyroid hormone, high level of the calcium, and low level of the phosphate. Low level of the phosphate. What happens when there is a high level of the calcium? What happens when there is a high level of the calcium? High level of the calcium, basically, which is also known as the hypercalcemia. Maybe you discuss about in the general pathology that high level of the calcium can activate the enzymes. And if in a person there is a high level of the calcium, then the activation of the enzyme will be high or low? High. Then the activation of the enzyme will be high. We all know that. There is a pancreas. Pancreas are located here. And due to high activations of enzymes in normal person, what happens? For example, if this is a stomach, and here are the pancreas located. These are the pancreatic ducts. In normal person, what happens? In normal person, the pancreatic enzymes are released into the pancreatic duct and then released into the small intestine, into the duodenum, in the second part of the duodenum. But when the activation of the enzyme will be more and more, then some of the enzyme will also activate into the pancreatic parenchyma. Then some of the pancreatic enzyme will also activate into the pancreatic parenchyma. And those enzymes which active into the pancreatic parenchyma, these enzymes basically cause the injury of pancreatic parenchyma. And this is known as autophagy. Or this condition in which the pancreatic enzymes are attacking to its own pancreatic parenchyma. This condition is also known as pancreatitis. So we can say that if there is a high level of the calcium, it can lead to the pancreatitis. If there is a high level of the calcium, it can lead to the pancreatitis. And due to the pancreatitis, there is a pain in the epigastric region. Number two, due to the high level of the calcium, there will be also peptic ulcer. The pain of the peptic ulcer into the epigastric region. If examiner asks you like this, a patient present to you with complaint of the peptic ulcer, it means that he is discussing about the pancreatitis and also peptic ulcer. He is not going to say you that how the pancreatitis is going to happen due to a high level of the calcium. If examiner asks you a question like this, a patient present to you with complaint of pain into the epigastric region, it means that the examiner is discussing about and mentioning about the pancreatitis and peptic ulcer. Number one. Number two, due to high level of the calcium, the motility decrease. For example, this is a gut, and this is a gut. When gut is motile in nature, then the food content will pass through the gut. But when the motility will decrease, the food content will pass or no?
No.
Food content will not pass. Then it means that there will be the constipation. It will be constipation. So we can say that high level of the calcium can lead to the constipation. High level of the calcium can lead to the, guys, number 1, pancreatitis, peptic ulcer, constipation. Number 4, high level of the calcium has also some association with your anger. With your anger. The person always will be in angry condition. Within the angry condition, you have to say that anger, pancreatitis, peptic ulcer, pancreatitis, anger, and also constipation. Number 4, maybe many of you guys know that about antidiuretic hormone. Anyone knows about antidiuretic hormone?
Yes, sir.
What is the function of the antidiuretic hormone? Farheen? Antidiuretic hormone. Antidiuretic hormone. Alina? Antidiuretic hormone. What is the function of the antidiuretic hormone? Usman? What? Hanan? Reabsorption of the water. The main function, this is very basic. The main function of the antidiuretic hormone is the reabsorption of water. Just imagine. I am an antidiuretic hormone. Okay? I am an antidiuretic hormone, and antidiuretic hormone give the message with the help of B2 receptor. It gives the message with the help of a B2 receptor. When the antidiuretic hormone will give the message to the B2 receptors, then there is presence of the channels which are known as the aquaporine channels. These are known as the aquaporine channels. These aquaporine channels basically open. When the aquaporine channels will be the open, then the water from the kidney tubules will escape from the tubules and it will enter into the blood. It will enter into the blood. Just imagine. Now maybe a little bit difficult for you, but I will make easy. Just imagine. I am a antidiuretic hormone, and this one is a B2 receptor. Antidiuretic hormone. This is a B2 receptor. And B2 receptor basically open the aquaporine channels. When aquaporine channel will open, this is a distal convoluted tubule. And we all know in distal convoluted tubules there is present the fluid. What is present? Fluid. When aquaporine will channel open, then the fluid from the distal convoluted tubule or the collecting duct, in the collecting duct, the fluid will escape from the collecting duct and it will enter into blood. What happened due to the high level of the calcium? What is normally happening? I am antidiuretic hormone. Antidiuretic hormone give the message to the B2 receptors. B2 receptors cause the activation of the opening of the aquaporine channels. Then the aquaporine channel will open and the water from the collecting duct will escape from the tubules and it will enter into blood. High level of the calcium basically inhibit the B2 receptors, activation of the B2 receptors. It causes inhibit the activation of the B2 receptors. When there will be the inhibition of the B2 receptors, then aquaporine channel will open. When there will be not opening of the aquaporine channels, then water will be reabsorbed from the kidney tubules and it will enter into the blood. Then where the water is going? Into urine. So the high level of the calcium can lead to the polyuria, and due to polyuria the patient has the complaint of the polydipsia. We are excreting urine. It means that due to the dehydration, this patient has the complaint of the polydipsia. We will say there will be the polyuria and polydipsia. Polydipsia will be present. Number 3. These all are the features due to high level of the calcium. Due to high level of the calcium, what happened, guys? Number 1, what we discussed. Due to high level of the calcium, pancreatitis. Due to high level of the calcium, peptic ulcer. Due to high level of the calcium, constipation. Due to high level of the calcium,
Aggression.
Due to high level of the calcium, polyuria. Due to high level of the calcium, polydipsia. Now just come to other question. If examiner asks you a question like this, a 30-year-old male present to you with a history of epigastric pain, constipation, polyuria, polydipsia and aggression. What is your diagnosis? You guys will say it is due to high level of the calcium. It is due to high level of the calcium. And if examiner asks you a question like this, that a 30-year-old male present to you with complaint of epigastric pain, you complain of epigastric pain, polyuria, polydipsia, constipation, and upon investigation there is a high level of the parathyroid hormone, high level of the calcium, and low level of the phosphate. What is your diagnosis? Primary hyperparathyroidism. It is a primary hyperparathyroidism. High level of the calcium also act on the heart. And it causes the short QT interval. It causes the short QT interval. In cardiology, we will discuss about the what is a short QT interval and what is a non-QT interval. Now we will discuss about another point. For example, due to high level of the parathyroid hormone, no come. For example, these two guys were here. Come, shabash. I was parathyroid hormone. Okay. This one was a osteoblast. Osteoblast giving the message to the osteoblast. Just imagine. Parathyroid hormone is secreting more and more and more. When parathyroid hormone is secreting more and more, it means that parathyroid hormone is giving message to the osteoblast more and more. When the osteoblast receiving the message more and more from the parathyroid hormone, it will give the message to the osteoblast. What is the end product? What is the result? The activation of the osteoblast will be high. The action of the osteoblast will be higher. In hyperparathyroidism, in primary hyperparathyroidism or in the hyperparathyroidism, what we see? We see high activation of the osteoclast cell. When there will be the high activation of the osteoclast cell, then what will happen? It means there will be the bone resorption. There will be the bone resorption. And the bone resorption can lead to the bone fracture, bone pain. Now come to another statement. Now come to another statement. For example, examiner asks you a question like this. We have a multiple choice paper, so we will discuss multiple questions. If examiner asks you a question like this, that a 35-year-old male present to you with history of the epigastric pain, also about the constipation, polyuria, polydipsia, bone pain, and this patient also has the complaint of fractures. He also has a complaint of the or a history of the fracture. What is your diagnosis? Primary hyperparathyroidism. And if it enhance the question statement like this, on lab investigation there is a high level of the parathyroid hormone, high level of the calcium and low level of the phosphate. What diagnosis? It is a primary hyperparathyroidism. If any one of you have any type of the question, primary hyperparathyroidism, you guys can ask. Clear? Okay guys. Now we will discuss about the secondary hyperparathyroidism. What is mean by the secondary hyperparathyroidism? Secondary hyperparathyroidism, that there is a problem into the any other side. Just imagine. For example, Usman, come here. Just imagine. I am parathyroid hormone. Just imagine. I am parathyroid hormone, and this is a kidney. We all know that in the kidney, the reabsorption of the calcium from the distal convoluted tubule and inhibition of the phosphate from the proximal convoluted tubule was happening due to the high level of the parathyroid hormone. Now just imagine, if kidney is not working, and into the kidney, the activation of the vitamin D was also happening with the help of a parathyroid hormone. First of all, what was happening here in the kidney? Two things were happening. One is a high activation of the vitamin D, and another one, the high level of the calcium and low level of the phosphate. When kidney will not work, then all these function will happen or no? No. Vitamin D activation will be happen? No. When vitamin D activation will not happen, and serum calcium reabsorption will be occur or no? Serum calcium reabsorption will not occur. Not occur. Serum phosphate excretion will occur or no? No. We will say that the what will be the product. If there is a problem with the kidney, then there is a low level of the vitamin D. When there is a low level of the vitamin D, it means that there will be the low level of the serum calcium. Low level of the serum calcium, but high level of the serum phosphate. What was the normal function of the kidney? The normal function of the kidney was to increase the level of the calcium and decrease the level of there is the problem into the kidney. Due to the problem in kidney, now what will happen? The level of the calcium will decrease and the level of the phosphate will increase. Now tell me, Mosid, if there is a low level of calcium happen, when there is a low level of calcium will give the message to the parathyroid hormone, and it will say to the parathyroid hormone, please excrete more and more and also produce the calcium. Now I am parathyroid hormone. This calcium is giving the message to me. I am coming to kidney. I am saying that please do something. Kidney is saying I myself is not like how I can do. Kidney is not working properly. How is that possible to increase the level of the calcium? But I am coming again and again and again. What will happen? The level of parathyroid hormone will increase. So the level of the parathyroid hormone is increasing due to the failure of the kidney. Due to the failure of a kidney. And this type of the hyperparathyroidism is known as a secondary hyperparathyroidism. This type of hyperthyroidism is known as the secondary hyperparathyroidism. If examiner asks you a question like this, for example, and due to low level of the calcium, what will happen? Bone pain, bone fracture. We all know when what is the main function of the vitamin D? The main function of the vitamin D to do the mineralization of the bone. When vitamin D will be low, then mineralization of the will not occur. When mineralization of the bone will not happen, it means that bone are more prone to fracture and there will be the bone pain into the patient. Okay guys. For example, if you see any patient of the kidney disease, CKD patient, when you will work in the hospitals and you are into the nephrology ward or you are in the medicine ward and you are visiting a patient diagnosed with a CKD patient, you will see that there will be must written the test of the serum calcium, serum phosphate and parathyroid hormone. Serum parathyroid hormone. And if someone who is a resident asks you a question that this patient of the chronic kidney disease, what will be the lab findings in a patient of the chronic kidney disease? What will be the happen to the serum calcium? What will be the happen to the serum phosphate? And what will happen to the parathyroid hormone? What would you say? Your voice should be loud, guys.
The chronic kidney the PTH level will be increased.
The level of the PTH will be increased and calcium will be low, and what will happen to the phosphate? It will be increased. So, if we are seeing or visiting any patient in the nephrology ward which is diagnosed with a CKD, we will see high level of the parathyroid hormone, low level of the calcium, and high level of the phosphate. And this type of the hyperparathyroidism is known as secondary hyperparathyroidism. Another one. For example, guys, we also have seen that in primary hyperparathyroidism, there is a high level of the parathyroid hormone. In secondary hyperparathyroidism, there is also high level of the parathyroid hormone. And due to the high level of the parathyroid hormone give maximum stimulation to the osteoblast cells. Then this maximum gives stimulation to the osteoblast cell, and what is the end result is bone fracture. And the condition in which the bone are going to fracture to the high level of the parathyroid hormone, this condition is known as osteitis fibrosa cystica. This condition is known as osteitis fibrosa cystica. What is the osteitis fibrosa cystica? You guys will say that osteitis fibrosa cystica. It is a condition in which the high level of the parathyroid hormone give the maximum stimulation to the osteoblast, and it will give the maximum stimulation to the osteoblast. When with the high stimulation of the osteoblast, these are the bone resorptive cells. These are the bone resorptive cells. When these are the bone resorptive cells, the bone resorption will happen, and in the end, what we will see? The bone fracture. There will be also a hemorrhage. When the bone will be the fracture, there will be the hemorrhage, and due to the hemorrhage, there will be the cyst formation. That's why I say that these are the osteitis fibrosa cystica. Cystica means the cyst formation, and these type of the cysts are seen into the subcapsular region. At the subcapsular cause the problem to the kidney. And if the bone are going to the fracture due to this condition is known as a renal osteodystrophy. This condition is known as a renal osteodystrophy. We all know that in the secondary hyperparathyroidism, due to the problem with the kidney, vitamin activation is not going to happen. When the vitamin D activation is not going to happen, then what we will see in the patient? We will see that the level of the vitamin D is low, mineralization of the bone are not going to happen, so bone are more prone to fracture. And if a person have the pain of the bone pain or the bone fracture due to the problem the CKD or the problem of the kidney, we will say that this is a renal osteodystrophy. Renal osteodystrophy. This was all about secondary hyperparathyroidism. Now we will discuss about the secondary hyperparathyroidism as FP. In secondary hyperparathyroidism, what we see in the labs? What do you see in the labs in the secondary hyperparathyroidism? High level of phosphate and high level of parathyroid hormone. You will say that in secondary hyperparathyroidism, there is a high level of parathyroid hormone, low level of calcium, high level of serum phosphate, and high level of
ALP.
low level of the vitamin D. Another, if we are seeing the labs of primary hyperparathyroidism, then what will be the findings in the patient of primary hyperparathyroidism? If we are seeing the lab of the primary hyperparathyroidism, mostly, which findings you will see in the patient of the primary hyperparathyroidism? Yeah, lab findings. Increase PTH, increase calcium, decrease phosphate. We will see increase PTH, increase PTH, increase calcium, and increase phosphate. Now we will discuss about the tertiary hyperparathyroidism. Now we will discuss about the tertiary hyperparathyroidism. That what is the mean by the tertiary hyperparathyroidism? Right. In the tertiary hyperparathyroidism, patient also has a problem in the kidney. Because we say that in the secondary, you also said that the problem in the kidney. And the tertiary, you are also saying that the problem is. Then how you can differentiate between both of them? Understand or no?
Yes.
I am saying in tertiary also the problem in the kidney. If in the secondary also problem in the kidney, and in the tertiary also problem in the kidney, then how we will differentiate between the both of them? It is the tertiary hyperparathyroidism. So, what is the difference between the tertiary and the secondary hyperparathyroidism? In the secondary hyperparathyroidism, we know there is a problem in the kidney. We know. But maybe it is a AKI due to AKI means acute kidney injury.
Yes.
Or maybe this person has the kidney problem to 6 months ago, 7 months ago. But if a patient on dialysis and the level of the parathyroid hormone is high, the level of the calcium is also high, then we will say that this patient is suffering with the tertiary hyperparathyroidism. But in secondary hyperparathyroidism, there is a high level of the parathyroid hormone, just not high level of the calcium we will see here. We will see here low level of the calcium. So it was all about the hyperparathyroidism. If anyone has a question, you guys can ask. Otherwise,
Sir.
take a